Hello, and welcome to Good Grief, the podcast dedicated to demystifying and destigmatizing grief with compassion and humor. I'm Nikki. I'm a death doula and a grief coach in Columbus, Ohio. And today I have another amazing guest episode, and I'm always excited to share my conversations with you, my listeners. And this one, I was definitely intrigued when they reached out to me. So this will be a conversation with Dr. Cohen, and I'm going to let, we'll get into it in the conversation with him. But the reason why I was so interested, so Dr. Cohen is a pediatric surgeon. He's got like 40 plus years experience with pediatrics. So this is children, babies, small humans, and dealing with terminal or chronic illness, disease, surgeries, and all of the things, and is like one of the like big knowledge people on pediatric surgery in the United States. He worked at Johns Hopkins and at Boston Children's Hospital, and is just kind of renowned for his work in pediatric surgery. And that in and of itself is pretty cool. But he recently wrote a book called Comfort Always: Healing in the Age of Technology. And he shares a lot of great stories in that book. He talks about a couple of them in this episode, but my interest in this was the grief that physicians experience in dealing with things like terminal illness, and especially when it comes to kids, to be that person on the front line, having to give bad news to family, or, navigating deep, heavy emotions and fear and anxiety with people and parents and children when it comes to these heavy, heavy topics. So that's what we're going to get into in today's episode. Very excited for you to tune into that. Before we dive in, if you love and appreciate my show, please leave me a rating and review. Quick, easy, free thing you can do, takes 30 seconds, and it's the best way more people can find me. If you really appreciate what I do, you can visit me over at patreon.com/Nikki the Death Doula. By supporting me on Patreon, all the money I receive there goes directly to me providing pro bono work. So anytime I can give back to the community, anytime I can give a little bit of my services to somebody who might not otherwise be able to afford them, I'm happy to do that because of my Patreon support. So please, please, please head on over there. But anyway, you're not here to listen to me prattle on and on and on about this stuff. You're here to listen to my great conversation with Dr. Alan Cohen. Thank you, everybody, for tuning in again this week to Good Grief with Nikki the Death Doula. I am so excited about today's guest. Ooh, this might be my first doctor. I have Dr. Cohen on our show. He is a pediatric neurosurgeon. Wow, that's a lot. With more than four decades of experience treating critically ill children at institutions such as the Boston Children's Hospital and Johns Hopkins, which that is a tongue twister. I'm glad I got that right. And he's recently written a memoir, Comfort Always: Healing in the Age of Technology, which I've not read yet, full disclosure, but I'm so excited. I definitely want to grab a copy. So, but he starts discussing the emotional weight physicians carry when delivering end-of-life diagnoses to children and their families. So now you know why I was excited to have him on my show. So Dr. Cohen, it's so nice to meet you. Thank you for agreeing to be here today.
Thanks for having me, Nikki. Pleasure to be.
Awesome. So you have 40 plus years of experience working with critically ill children.
Yeah, I'm an older guy, yes.
Yeah. So tell us a little bit about that. Like what brought you into the world of wanting to work with children?
Many people thought that I have a mentality of a 5-year-old, and so that would be my realm. I actually never knew that there was a field of pediatric neurosurgery when I was in medical school.
Yeah.
And I was influenced by a guy named Fred Epstein when I was a resident. And he was a very great surgeon, a charismatic guy. And I thought, well, I want to be like him. And so I was influenced by somebody like that.
Awesome. Yeah. And yeah, I guess I wouldn't think of pediatric neurosurgery either, but everybody's got a brain, from before we were born. So babies would need brain surgery too. So what what was your biggest hurdle getting into this? Like, was this, I imagine you go to school for like a million years to be a neurosurgeon at all, let alone for children and babies. Like, is there a longer learning process to being a pediatric neurosurgeon than just like an adult human neurosurgeon?
No, it's a great field, but there's a long period of training.
Sure.
The reason I did this book is because most of my work is in academic neurosurgery and writing articles and doing research and talking to the scientific community. This is the first time I've written for the general public. And what I wanted to do is I've had, 40 years of experience taking care of kids. My focus has been on children with brain tumors, which is a weighty task
Wow.
to concentrate on is that it's about the forgotten art of healing in this modern age of
Yeah.
technology.
Yeah.
And most of the time I spend dealing with all the new advances in surgery, the MRIs and CAT scans and PET scans and microscopes and endoscopes and all the things that allow us to do things that we couldn't even do maybe a couple of decades ago. But I think the importance is that in this age of technology, there's a tendency to forget the art of healing, the bedside diagnosis and
Yeah.
patient-doctor family relationship. And so it's an attempt to resurrect this forgotten art of healing in the modern age of technology.
I love this. I love this so much. And this is something I see a lot in my line of work, working with people who have terminal illness. A lot of the clients I have had over the last few years have had cancer. I've had a couple like end stage kidney failure as well and heart failure, but it's that aspect of the comfort care and not just the foregoing treatment, right? The level of caring, still caring for somebody and helping them to, even though the people I work with will never be cured, they will never get better, but they can still heal without all the fancy, treatments and bells and whistles, and they can still have that emotional healing. Is that kind of what you are just getting at here?
Yeah, exactly.
Yeah.
What I'm trying to, pardon me, the idea is that with these advances in technology, we can do some amazing things
Yeah.
to combat disease and relieve suffering and in
Yeah.
many cases prolong life and in some cases obtain cures.
Yeah.
Um, but we tend to forget the basic things like comfort, kindness, empathy, compassion, things like that, humility, humor. I think those forgotten arts that everybody knows them, but without thinking about them, it's easy to say, well, I've got a patient, I've got three hemorrhages in the emergency room and two brain tumors in the ICU.
Yeah.
It's easy to forget that the patient is a person.
Right.
And I think that's what the purpose of the book is. It's stories of patients that I've cared for over 30, 40 years.
Oh,
Uh,
wow.
what's nice about being an older pediatric neurosurgeon is that I get to follow the lives of my patients who
Yeah.
grow up and have kids of their own. And it's a very unusual field. And I didn't know about it before I
Yeah.
was in it, but it's probably one of the very few fields where you actually become a member of the family. That's the how
Yeah.
intense this is, these relationships that develop. And it's very special.
Oh my gosh, I bet. Oh, and how fulfilling not only to see your patients grow and thrive, but then to keep you come back and they've got kids of their own and you can see that progress. Oh, that's
Yeah,
beautiful.
it's a very unique experience. And that's
Yeah.
what I'd like to share. And the intensity of what we deal with in pediatric neurosurgery in
Oh my
children with
gosh.
life-threatening illnesses, these are our
Yeah.
most vulnerable. The intensity of the emotions is much stronger than you can imagine from anything that you would watch on television. The real life
Oh,
parent surrenders their child to me, an unknown person, for 8, 10 hours of an operation, and they don't know whether they're going to see their child alive or what's going to happen. That period in the waiting room is just a very, very intense time. And what I tried to do is capture some of the emotions of what it's like for
mhm.
patients and families facing the crisis of their lives and how resilient many of them are, and tell those stories.
Yeah. Oh my gosh. Yeah, I've been in the waiting room for family members, waiting on life-saving surgeries and unknowns, and it's terrifying. It really is, but it's never been for a child, so I can't even. I don't have children of my own either, so I will never speak to what it's like to have a child. But so, and I want to come back to that. I want to talk about some of these stories of patients you've served, but I want to know a little bit what kind of experience this has been for you personally. Like, especially if you have to give that devastating bad news to a family that there's not much you can do, or God forbid, the surgeries didn't work, or whatever. Like, you have to carry that weight of giving this news to parents of children. And what has that been like for you?
Yeah, you're right. It takes a toll. It's one of the most difficult things I've ever had to do is to
Yeah.
tell a family, I'm sorry, but your child has a brain tumor. And
Oh,
after all these years and decades, it doesn't get any easier. And I'm a member of a healthcare team with other surgeons and intensivists and oncologists. And the whole team feels this as well. In fact, sometimes the team needs support because we can go into depression as well. It's a very,
sure.
very tense field. But with advances in technology, we can do things that we couldn't do recently, and so the outcomes are better. It's just that there's still a long way to go. And the
Right.
purpose of the book is to emphasize that not only do we have these advances in technology, but we can't forget this basic human kindness, the
Yeah.
interaction between the doctor and the patient. There's a
Yeah.
lot of tests that we can do. We do a barrage of tests to try to find out what's wrong with a patient. And sometimes it's not so helpful. And just a thoughtful history and exam at the
Mhm.
bedside, interaction with the family where we learn about the patient. Each patient is different, can cut through a lot of the problems.
Yeah. Yeah. And as a human being, I appreciate that. Like, I would rather a doctor come in and sit down with me and my family and get to know me a little bit other than just come in, ask the few questions, run the tests, and leave. Like, I feel more comforted, and I would have more faith in a doctor that took the time to know who I am and know who my family is versus one that seemed to just want to do the surgery and run out the door.
Yeah, there's a great physician, William Osler, who was one of the founding fathers of Johns Hopkins in the late 1800s.
Mhm.
And he famously said, the good physician treats the disease, the great physician treats the patient who has the disease. He said, listen to the patient, he's telling you the diagnosis. And we tend to forget that with all the barrage of tests that we have.
Yeah.
Good common sense is something that tends to be forgotten.
Yeah. Yeah, I totally agree because and I won't pretend to know what it's like to be a doctor, not a doctor, but to just remember that you're not just, treating all of these symptoms in this disease, but it's a human being behind there who is scared, confused, maybe a little lost, and maybe if they don't have a big family, they're a little bit alone too. I see this a lot when I have people who are older, maybe don't have children that live in the same state anymore, or just don't have any family at all, and they've got nobody to help walk them through all of this, which is where they bring me in. But to then, also have a doctor that would be willing to see them as a human being and not just a cancer, right?
Yeah, I think it's a very basic point. It seems simple, but it can often be overlooked. And
Right.
uh, there was someone, Moses Maimonides, who worked 1,000 years ago, a Jew in Egypt, who was a philosopher and a teacher and a rabbi and a physician. He remarked, may I never forget that the patient is a fellow creature in pain. May I never consider him merely a vessel of disease, just as you were
Mhm.
saying. And that's what tends to be forgotten because we're in the era of the business of medicine. The
Right.
doctor is a healthcare provider and the patient is a client. And we can do things. We have this electronic medical record now where we can get a lot of information in the computer. We can communicate around the country and around the world about patients.
Yeah.
But a lot of this tends to be garbage in and garbage out. Often, if you go to see your physician, you might see the back of his or her head as they're entering data into the computer. And
Right.
the here is it's a request for people to take their hands off of the computer and put them on the patient to remember
Yeah.
that we're dealing with the patient. The
Yeah.
idea is that technology and humanity are coexisting, but
Mhm.
technology treats the disease and humanity heals the patient. The two of them are both
Oh,
necessary. That was the point
yes.
I'm trying to make.
Oh, I love that. And I would think even a little bit vice versa to understand. Now, granted, the patient, especially in situations like yours or the people I'm working with, things are scary and chaotic, but to also understand that that physician you're dealing with is also a human being and also has a family and may have their own loved ones facing medical challenges at that time, or may have just given another family down the hall really bad news and is now coming to see you. Does that seem fair to say?
It's very true. And, we're taught in medical school to maintain a professional relationship, which is important.
Sure.
But in pediatric neurosurgery, more than many other fields, you really become a member of the family. And I think
Yeah.
being your own person allows you to develop a bond between the family and the patient. And I think
Mhm.
that's all important. I think what we want to try to do is to have a situation where the patient wants to visit the doctor again, wants
Mhm.
to come back and see the doctor, even when things are tough, even when there's a life-threatening condition, because it's not a matter of trying to give good news and sugarcoat the diagnosis. It's a matter of um, controlled optimism.
Mhm.
And even in the most serious of conditions, there are things that can be said that can help. Words can help heal. And that's the importance of this, that there's
Yeah.
more to healing than laser therapy and advanced antibiotics and anti-cancer drugs. It's the
Yeah.
art of healing, and it's important to remember that. That was
Yeah. Oh, I love that. I'm more and more excited to read your book now. Um, so, oh, I just had a question. Where to go? Oh, so back to your book then. What, if you could pick one or two, like who are your most memorable patients that you've worked with, or some of the most memorable situations you've had?
Yeah, each of the stories is pretty powerful, and I was sort of keeping a diary along on the years.
Oh,
I
nice.
would end up writing the book at night after cases, so that's why it took several years to get it done. But my area, I'm a pediatric neurosurgeon. We take care of children with surgical disorders of the nervous system, the brain and the spinal cord and the
Yeah.
peripheral nerves. My particular focus has been in childhood brain tumors,
Yeah.
and childhood brain tumors are actually the number one cause of a solid tumor in children, and they're the number one cause of cancer death in children. It's a dubious
Oh,
distinction to have. But the results are better now. It's a good time to be a pediatric neurosurgeon. We can actually cure some malignant tumors that we couldn't think about doing even a few decades ago. But
yeah.
the cases are pretty intense because, again, when I tell a family that their child has a brain tumor, I know that it's going to change the life of the child and the family forever. And
Yeah.
it's a long-term relationship. And as I say, I sort of become a member of the family. And it's
Yeah.
very gratifying to be able to do that because you have to give some of yourself too. The importance, though, is to create that bond, the doctor-patient bond. And
Mm-hmm.
an example of a case, each of the cases is very special, but one that stands out to me is the second chapter, where when I was working in Boston Children's Hospital, got a phone call from a parent out of state about her 2-month-old infant daughter, and could we take a second opinion? And what had happened was she had a pregnancy, and with technology, she had an intrauterine ultrasound with the baby still in the womb
Mm-hmm.
that showed a giant brain tumor filling the left hemisphere of the infant's the fetus's brain.
Oh my
Giant
gosh.
brain tumor diagnosed as a malignant brain cancer, and they continued to follow. This was through the pregnancy, and it continued to get larger. And out of an abundance of compassion, the doctors and the family made a plan to have them take the baby home so that they could spend time with her at home before she died and not have to
Yeah.
be in the ICU. But she was born, and the family, she was born, the family took her to the ocean so that she could see the water and feel the
Oh,
sand. And the mother wrote very powerfully about what it was like to take her infant daughter home with plans to bury her, thinking that the next time they would visit the ocean was going to be to spread her ashes.
oh
You
my
can
God, I'm gonna
imagine what it
cry.
must be like if you're thinking about grief, what it must be like to try to plan your infant child's death. And this mother wrote eloquently about what that was like and very powerfully. And then at home, the tumor continued to enlarge, but the child started doing better than they expected. And so they came for a second opinion. And we thought, well, gee, maybe there's not enough information to give this kid a death sentence. And one of the lessons that I had learned from Paul Rossman, who was a famous neurologist, medical expert in the nervous system, was that we treat the patient, not the x-rays. We said, let's take a look. We went to the operating room and we found that the tumor was very unusual, but it wasn't cancer. It was a benign tumor. And we were able to remove that. 11 years ago. This kid is in school now. She has some deficits. She had a genetic syndrome, Down's syndrome, but she's a
Okay.
functioning kid. She's a functioning kid. She's in the fifth grade. She has two boyfriends and the love of her family. And that's a powerful story. And what's most powerful about it is the beauty with which the mom has written about it, what it must be like thinking about grief, to plan to bury your own child and find out
Yeah.
that she's still alive.
Wow. Oh my gosh. Oh, I got choked up hearing that story.
It's hard to
Ooh.
even tell the story, and you can imagine what it must be like to be part of the family.
Oh God. I really I have no frame of reference for that. I can't possibly imagine what that would be like. But ooh,
But that's
whoo.
why these stories are very intimate and very
Yeah.
powerful. And that's what
Yeah.
I wanted to try to share, because we talk about brain surgeons being brusque and arrogant, and some of them are, but
Hmm.
we've really tried to change that reputation. But
Yeah.
the power of the things that we do in life death situations is very moving.
Yeah.
And I wanted to try to be able to share, to bring the reader to the bedside and into the operating room and
Yeah.
try to show some of the beauty of the nervous system, some of the history of our field, and with powerful stories and some humor as well, to try to
Hmm.
make pediatric neurosurgery come real for people.
Yeah. So, if you could speak to all the budding pediatric neurosurgeons in the world, all the students today that want to be a pediatric neurosurgeon, what's the number one piece of advice you would give them?
Well, pediatric neurosurgery, as you mentioned earlier, it takes a lot of time and training, and we need
Yeah.
to learn a lot of Latin words and things like that. And that's what we do in medical school. And I think just to
Yeah.
remind anybody that when you do this, it's something that the hours are long and sometimes the training is grueling. But if
Hmm.
you like what you do, you have to love what you do, because
Yeah.
otherwise it's just going to be too much in terms of the hours.
Yeah.
But to be able to feel it's a rare thing to have a privilege to be able to turn a disease around and make a difference in the life of a patient and a family, and
Yeah.
that's what makes the long hours worthwhile.
Oh. Oh, I can only imagine. So then vice versa, if you had, and I'm sure you've had this before, you have a new family coming in and they're just now finding out that their child has a brain tumor. Um, what words of comfort or guidance would you give them? Even, outside of the here's the surgeries we can do and here's the treatments, just like what comforting words would you say to them?
There's no one size fits all in this, and every case is different. But to try to remind them that they don't need to drink from the ocean. We're going to take it one step at a time. There's a whole team of people that are going to help support them and help support the healthcare people dealing with this as well. And that we move one step at a time. And our goal in every case is to cure the patient. But in the cases that we can't, we're going to give them full support and make everything as pleasant as we
Yeah.
possibly can. There's the title of the book, Comfort Always, comes from a saying from Edward Trudeau, who was a physician in the late 1800s who himself died of tuberculosis. And
Oh.
he opened a sanatorium in upstate New York in the Adirondack Mountains, and patients flocked to him by the thousands when there was no treatment for the tubercle bacillus, which had just been identified in the late 1800s. But
Yeah.
they came for his compassionate care. He was called the beloved physician, and they made a statue of him there that still stands. It
Oh,
was
wow.
designed by Gutzon Borglum, who's the guy who developed Mount Rushmore in the South
Okay.
Hills
Yeah.
of South Dakota. And on the back, there was an inscription in French: Guérir quelquefois, soulager souvent, consoler toujours. To cure sometimes, to relieve often, to comfort always. That's the
Oh.
essence of the book, and that's the power. This is something that still stands.
Yeah. Oh, I love that. And I love the title. I mean, I read it prior to meeting you and everything, but I love just always remembering that for physicians to remember comfort
I
and
think
to,
everybody should remember that. And that's why the book is meant for a general audience. It's meant for the general population, to try
yeah,
to translate some of the Latin things that we do in physical diagnosis and
yeah,
neurosurgical care for the general population, because it's very interesting, like a detective story, but it's
mhm,
also indicated for medical students and physicians as well, to remind them that these are things that we all know about: the importance of optimism, in treating disease, because it's a lesson that is easily forgotten as we
yeah,
approach this business of medicine that we're living in.
yeah. Oh, so what is your hope for the future of neurosurgery, like pediatric or otherwise? Like,
It's a great time to be a neurosurgeon because we are in the age of technology. We have molecular diagnoses now. We used to have a diagnosis of a brain tumor. It's a medulloblastoma and a ependymoma. We give it a name. And
yeah,
now, with all that's going on in molecular diagnosis, we can look at things in a different level. We call this next generation sequencing. And it's hard to even remember the names of these tumors now because it's like an alphabet soup. But the advantage is that in cases where we can't remove the entire tumor, or if it is a
Mm,
malignant cancerous tumor, there are treatments that are now designed so that can be more toxic for the tumor and less toxic for the patient. And so it's a really nice time to be in, and we have instruments and things like that that
yeah,
can help us in the OR. But there's a famous saying, a fool with a tool is still a fool. So we can't let the instruments do the work. There's a lot
sure.
of surgical judgment going on. But it's a great time to be a neurosurgeon, a pediatric neurosurgeon. And Maimonides, 1,000 years ago, would never dream of these things that we can do that couldn't even be thought of at that time.
Right.
But his words still stand that the patient is a person, and we can't forget that.
Yeah. Well, I mean, even just in your time practicing, because you've been practicing for over 40 years, like I can't imagine the advancements that have been made just since you've been doing this.
Yeah, I mean, it's unbelievable, and it's still going on right now.
Yeah,
Technology has allowed us to do a tremendous number of things, and but again, it's a balance, technology and humanity, and we want
right.
to work with both of them, not just one.
Yeah. Oh my gosh, thank you. So before we get towards the end of the episode, I have a little tradition on my show where I pull a random card from the death deck. I don't know if you're familiar with these, hopefully not. They're just conversation starter questions about death and dying, but I'm going to pull a random card and I'm going to let you answer it and then I will answer it too because fair is fair. So, oh, this one's weird. I don't know. After I've died, please announce my death on social media. A, pretty quickly as possible. I'd love all my friends to know ASAP. B, please don't put this on Twitter. Or C, I don't really care, I'm dead. So, how would you like people to announce your death on social media?
Uh, Musically, how about that?
Ooh, okay.
Yeah, yeah, I think musically. I'm not sure what song. We use a lot of music in the operating room. I try to choreograph the case because I think that people perform better in a stressful situation when they're relaxed.
Yeah.
So we do things, for example, when the anesthesia team puts the patient to sleep, we play Staying Alive. And when the tumor comes out, we play James Brown, I Feel Good.
Oh
Uh,
my God, this is
and
amazing.
and I may not look the part, but my particular genre is rap. So I think I would like to have some rap music played at the funeral for people to remember me and to give them
Stop
a
it.
smile.
Oh my gosh, you've surprised me. I love that.
Okay, your turn now.
It is my turn. Well, honestly, like I'm a little bit of the I don't really care, I'm dead camp because I am gone. Um, I know there's a lot of people that would be sad. I would like people to know as soon as possible after I'm gone because I'm sure people would want to come to whatever memorial service my leftover family might choose to have. So, I never thought about music though. That's really interesting. Maybe somebody come up with a cool video or something.
But one of the powerful things in seriousness is that the mother of that 2-month-old child who I told you wrote so eloquently about her
Yeah.
daughter, they were prepared to bury their daughter at 2 months of age. And her feeling was a lifetime is a lifetime. And we're going to make sure she knows that she is as loved as she is. And that makes all the difference to people. So
Yeah.
time probably is not as important as one might think it is.
Hmm. Oh my gosh. Yeah, I love that. A lifetime is a lifetime, no matter the length or oh my gosh, that's so very true. And I've worked with clients who are in their 20s, which is really heartbreaking for me and for them, but I love trying to help them find their meaning and that even though they've only been on this planet 2 decades, that they were still had a whole lifetime. They had 20 some years on this planet. So yeah, even a one day life has had an impact. So love
But
that.
things have changed, you know, at a major hospital like Johns Hopkins. I'm a member of a team. I have the colleagues in neurosurgery and intensive care and nursing and palliative care. We have child life specialists all gathered together to try to help the family get through this. And I
Yeah,
think the important thing to remember is that there's a balance between honesty and hope. But we always want to find some way to find hope, no matter what the situation is. The answer is not to sugarcoat things and tell things that are not true, because then you'll lose the confidence of the family. But
right.
there's always something, another treatment to be tried, a
Yeah,
pain to be controlled. And I think the importance is to remember the sanctity and the strength of that doctor-patient-family relationship.
yeah. Oh my gosh. So, now that we're getting towards the end, is there anything else that you really want to share with my listeners about your book or about, your viewpoint on comfort always?
Yeah, I hope you like it. If you're interested, it's on Amazon. I think it's a good read. Again, this is my first foray into the readership for the general public. Uh,
Yeah.
but let me know. And if you have any questions, I'm at Johns Hopkins in Baltimore, Maryland.
Awesome. Well, thank you, Dr. Cohen. This has been such a cool conversation. My first doctor, and you've surprised me. I really enjoyed this conversation. So thank you so much for being here today.
Thank you very much for having me. It's been a pleasure.
All right. Another huge, huge thank you and shout out to Dr. Cohen for coming on my show and sharing his expertise, his stories, his amazing mind. Please go check out his website, his book. They are in the description below. Please go click away, get a copy of his book. It's phenomenal. And he is just a lovely human being, and I want to support him. And I would love for you to do that too. And if you would like to support me, again, you can go to patreon.com/Nikki the Death Doula, or even easier, just leave me a rating and review wherever you're listening right now. That's the quick, easy, free thing you can do. It doesn't cost you a penny. And you can know that you did a good thing for me, because that's just how podcasts get boosted up in the algorithm, by more and more reviews. So that would be amazing. And if you want to reach out to me, if you have a story you'd like to share on my show, please reach out to me. You could go to nikkithedeathdoula.com/podcast. All the information, you can find the information on my guests that have been on the show. There's also a link to Dr. Cohen's book there, books of other guests I've had, websites of other guests. I've got merch on there. I've got t-shirts. I've got stickers for your water bottle or wherever you want to put your stickers. Put them all over the place. It's guerrilla marketing. Anyway, got some great stuff there. So you go to nikkithedeathdoula.com/podcast. You can also submit to be on the show on that link as well. So that is all. Thank you so much for tuning in this week. We've got one more episode left in the season, you guys. Oh my gosh, I can't believe it. But next week we got a great one. So stay tuned. But remember, as always, grief is yours. Your feelings are valid. Grief doesn't always have to suck. Good Grief with Nikki the Death Doula is produced by Nikki Smith of Nikki the Death Doula LLC in Columbus, Ohio. Nikki the Death Doula LLC is for consulting, education, emotional support, and guidance, and is no way considered a funeral establishment or licensed mental health establishment. Scripts, editing, sound design, literally everything with this podcast is done solely by Nikki Smith of Nikki the Death Doula LLC.